How does social isolation affect children? Have you ever wondered how being alone can shape a child's future? Social isolation in children is a serious issue that can lead to various challenges in their lives. When children lack regular interaction with peers, it can affect their development and overall well-being. At its core, social isolation can increase stress levels in children. This stress leads to higher amounts of cortisol, which is a hormone that can harm both mental and physical health. Children who experience this heightened stress may become more vulnerable to health problems later on. From a brain development standpoint, social isolation can have a negative impact. It particularly affects the prefrontal cortex, which is essential for planning and social interaction. Research shows that without social interaction, communication between neurons in this area can suffer. This may result in difficulties with cognitive functions and social skills as children grow. Behaviorally, children who are socially isolated often struggle with communication and social skills. They might display symptoms similar to attention deficit hyperactivity disorder, experience emotional issues, and show less interest in engaging with others. As they age, these children may feel lonelier and less optimistic about their futures. They may also become less physically active. The effects of social isolation do not just disappear when childhood ends. Isolated children are at a greater risk for depression, heart issues, inflammation, obesity, and lower educational achievements as adults. This long-term impact highlights the need to address social isolation early on to prevent ongoing negative outcomes. Within family dynamics, social isolation can worsen behavioral problems. When children have limited peer interactions, they may rely more on family members for social needs. This can create additional stress or conflicts within the family if behavioral issues arise. It is essential for families to support children in developing social skills and expanding their social networks to combat isolation. There are practical steps families can take to help mitigate the effects of social isolation. Encouraging regular peer interactions through school activities, community programs, and extracurriculars is vital. Families should also support children in developing communication skills at home. If behavioral symptoms such as attention deficit hyperactivity disorder or emotional difficulties arise, seeking professional help can be beneficial. Creating a supportive family environment that promotes open communication and emotional security can help children feel more connected and less isolated. In summary, social isolation can significantly affect children by increasing stress, impairing brain development, and leading to behavioral and emotional challenges. These effects can persist into adulthood, impacting overall health and social functioning. Families play a key role in recognizing signs of isolation and providing the necessary support to promote healthy social development and address behavioral issues linked to isolation.